Hi, my name is Chloe Harling, and my case study is on screening tools for cancer detection. Cancer screening was not implemented until the 20th century. Before this time, most cancers were not discovered until it was too late to treat. The first cervical cancer screening test was developed in 1943, which identified precancerous and malignant cervical cells through a procedure commonly known today as the Pap smear. Then, in 1968, the World Health Organization implemented population-based screening for cervical, breast, and colorectal cancers after such screening tools were deemed effective preventative measurements by identifying cancers in their early stages. Currently, breast cancer is the most common cancer among women in the world, with cervical cancer as the third most common, and for men, prostate cancer is currently the second most common cancer worldwide, and colorectal cancer is the third most common when comparing both sexes as one group. It is well known that early detection of cancer through screening processes led to improved diagnosis, less invasive and expensive medical treatments, and decreased mortality rates. For example, one major cancer treatment that can be avoided through early detection is chemotherapy, which can be extremely harmful to the human body and has a long recovery rate. However, there are multiple barriers that communities face in cancer screening, which include the cost of the procedures, education regarding the importance of early detection, and religious backgrounds. Strength is the new technology that allows us to detect cancer at early stages. Weaknesses are the barriers that communities have to face for cancer screening. Opportunity is the possibility of lowering the mortality rates of cervical, breast, colon, and prostate cancers through early detection. And lastly, threat is to the health of men and women who face barriers to being screened annually. Currently, the CDC plays a big role in promoting and improving screening techniques, encouraging HPV vaccinations to help prevent cervical cancer, and creating standardized methods of evaluations in various communities. The root causes of the barriers to cancer screening are religious beliefs, increasing medical expenses and inability to afford screenings, and the lack of knowledge regarding the importance of early screening and high mortality of cervical, breast, colon, and prostate cancers. According to the social ecological model's community health promotion, public and private sectors work together to address issues and promote health within certain communities where the prevalence of specific diseases are high or are of poor socioeconomic status. With that being said, one alternative solution is establishing or funding low-cost clinics in areas of low socioeconomic status. That way, cancer screening can be available to individuals who cannot afford to pay for the procedures. A second alternative is to educate and promote HPV vaccinations. The recommendation is to continue promoting HPV vaccinations in young females, educating the public on the effectiveness of early detection in cancer screening, and lowering the cost of medical expenses through low-cost clinics and funding. Educating the public through posters, school announcements, news reports, and much more would be the quickest measure, with only taking about 2 to 3 months. However, the other two action plans require funding and laws. Establishing nationwide HPV vaccination requirements for youth would take about 1 to 2 years to complete due to the long time commitment required to pass laws. There is also the possibility of facing backlash from religious groups and anti-vaxxers with this decision. Lastly, funding and establishing low-cost clinics would also take about 1 to 2 years due to the time required to pass funding legislation and build healthcare facilities. Through proper education, vaccinations, and low-cost clinics, early detection through cancer screening can be made available to men and women worldwide. In my opinion, the process of breaking those barriers and establishing universal screening will be very time-consuming because it requires much governmental action, which can also face much backlash. However, once passed, the mortality rates of cervical, breast, colon, and prostate cancers in men and women worldwide will be lower. Fewer invasive medical treatments will be performed, and less medical costs will have to be paid. Thank you.